Sorry for interruption. So, Om Shri Guru Basavalingaya Nama, a very good morning to all. So, after successful completion of 4 days of this national level webinar, we are happy to start the 5th day of Rachana Rupaka 2020, a national level webinar. So, today we are going to start the 9th lecture. On this occasion, we are having an eminent speaker, namely Dr. Anup Bhosgikar, Associate Professor, PG Department of Sharira Rachana, NK Jabshetty, Ayurvedic Medical College and PG Center, Bidar, Karnataka. Sir is going to present on a topic, anatomical relevance of Trimarma. So, on behalf of the management, principal, staff of all the SVM Ayurvedic Medical College, I heartily welcome you on this occasion, sir. And I also welcome all the viewers for present over here. Before going to start this session, I would like to introduce today's speaker. So I request Dr. Supriya Gudda to introduce the speaker.
Good morning all. It's my privilege to introduce today's guest speaker, Dr. Anup Bhosgikar. Sir is presently working as an associate professor at NK Jab Ayurvedic Medical College and PG Center Bidar, and also pursuing PhD at NK Jab Shetty Ayurvedic Medical College and PG Center Bidar. Sir has 12 years of teaching experience in both PG and UG Department of Rachana Sharira, and Sir has presented more than 35 articles in national and international journals. Sir has guided 4 PG scholars and co-guided as 10 PG scholars. Sir has participated as and resource person in Ayush Guru project at Jamnagar in 2017 and 2018, and also have 7 video classes on complete Garbha Sharira and Kala Sharira. Sir has visited as a PG and UG examiner at Rajiv Gandhi University and other deemed universities. Sir has presented 6 national and international papers, including state level seminars. Sir has guided for departmental physics scholars in various presentations in international, national, state level seminars, also at World Ayurveda Congress held in Kolkata and Ahmedabad. We are very honored to have you, sir. Thank you.
Thank you, Dr. Supriya. So, with this, I request the speaker to proceed for the session. So, please, sir.
Thank you, sir. First of all, I congratulate to the Department of Sharrachana of Ilkal College, SVM Ayurvedic Medical College, Ilkal. Thank you. I would like to thank you for calling me as a resource person in the Rachana Rupaka in 2020 to Kesidas sir, principal of SVM College, and also Prahlad Gangavati sir and Shankar Ling sir for conducting such a wonderful sessions in the Department of Rachana Sharira to receive the knowledge from the different parts of the country and to have the to gain the to or also and also it will help for the UG and the PG scholars of the different departments. So by this, I will start my session. The today's presentation topic, which is allotted for me, is the anatomical relevance of the three marmas. I think already the various topics have been, various lectures have been conducted from the Department of Sharirachana in the college on the web in this series of webinars. In this, so that's why I'm just in brief. We are discussing about this. What is the three marmas in this today's session? Before start to three marmas, just I will tell you what is meant by marma, because it is the clear-cut concept which has been explained or importantly explained in the Sharisthana of Shushruta Samhita, and it is an important point for the Rachana peoples to note it down, and also these are very important to prevent during the different surgical procedures by the Shalya peoples. So that's why those are called as a Marma, because so everybody's, I kept here question mark in the mind, why? Because every people's the first question will arise in the mind, what is the marma? So first I would like to define the definition of the marma. The different definitions have been explained by the different acharyas. In that, some of them I have quoted here. Among that one, most important quotation given by the Shuchuruta Sharira, that is a Marmani Vamsasira Snayu Asti Sandhi Sannipataha Teshu Swabhavataha Eva Visheshena Pranaha Tishtanti. That means the marma is a particular place where the 5 different anatomical structures, they will come together, and that is to be considered a conglomeration of 5 different rachanatmak entities. Those are to be mamsa, sira, snayu, asthis, and sandhi. The sannipata means the meeting, or we can say the conglomeration of these 5 different entities. That is mumps to be considered the muscles, siras are to be the word sira is meant for the veins, or also we can take the blood vessels. In commonly, snayus are considered the tendons of the human body. Sandhis are the different joint. Asthis are the bony structure. So where these 5 things are comes close together, that particular entity, in where next line has been explained, evam visheshena prana tishtanti. In that particular region, the prana is to be located. Visheshena, what is the vishesha? Particularly. What located? That is the prana tishtanti. The prana is present in that particular place where all these 5 anatomical structures, they will unite together. So such particular structure is to be, that particular point or that particular anatomical structure we can call as a marmahi. Also, on this verse, we commonly we define the word the marayantiti marmani, but actually this definition is nothing but the interpretation or the commentary given by the Dalanacharya on the previous quotation, that is marmani mamsasira. On this quotation, Dalanacharya has commented and he has defined the marma as marayantiti marmani, the particular structure which will where any aghata will leads to the death. So here, commonly we are saying that the 107 marmas are explained in our classics. So question will arise in our mind whether all the 107 marmas will lead to the death, isn't it? So, but answer is no. All the 107 marmas are not at all leads the aghata to that marmas may not lead to the death. Then why has quoted Marianti word? So when we split or when we see in the deep meaning of that particular word, we can understand that any aghata to that particular marma place, that may cause the different symptoms, which includes the pain, which includes the deformities, which includes any other dysfunctional loss of functioning of that particular area. So that means these symptoms, why these symptoms they have been explained means the particular cells on that particular area, they be going to die due to the aghata. So here that particular cell is also considered as a life or the prana. So when the particular regional cell may going to die, that means there is a loss of prana of that particular cell. So that's why based on that only we can say the Mariyanti word is suitable in the definition of a marma. So Mariyanti the marmani. He has just commented by on this Shushruta's quotation. So, whereas the Ashtanga Hridayakar has been explained, that is, Etra Dehe Desho Pidayanti Sati Rupcha Vishama Bhavati Tat Cha Marmaha. That means upper Desha, Yatha Dehe Desha. This see, every quotation when we discuss or when we see that every word has to be discussed here. Then and only it is the clear-cut definition we can understand. Dehe Deshe. Desha means the place. Place in the particular desha. Deha means the sharira. The place in the particular sharira. Pidayatihi iti ruk sati rukkaha. That ruk means the ruja. Ruja means the pain. Pidayati. That is nothing but that which is a painful. Vishamaha bhavati tatacha marmaha. The particular region of a sharira where there is a ruk or ruja will leads, that particular will called as a marmaha. Whereas in second line he has been expressed marana sadrusham dukkha daitvata. Marana sadrusham dukkha. Dukkha means the why we can understand the dukkha, that is a painful condition, a dreadful condition. Daitvat, which will gives us a pain like a death. Isn't it? So commonly when we will fall on the ground, we will say, just I was fall down and I will feel the pain like a death only. isn't it? So such a difficult pain we will feel in that particular region where the aghata will cause. So va iti marma shabdasya nirvachanam. So next line he has been completely told, that is the ruk will occurs in that particular place of a sharira where the aghata will leads, and that pain is just like a death, isn't it? So that region, so that's why that region is called as a marmaha, isn't it? So that is called as a marma. Again, Arunadatta has commented on that one like the Dallana only, Marana Karitvata marmaha. The painful, the pain which is like a feels like a death. That particular region is to be called as a marma pradesha. So these are the different shlokas which have been quoted by our acharyas while defining the marma. Again, the next line, Ashtangradayakara himself has been quoted, Tataha Punamamsa Siras Nayu Asti Sandhi Sannipata, just like a Shishruta. What it is? Tataha Punaha. It is the place where Mamsa, Sira, Snayus, Asti, Sandhi, these structures will come close together. Bahulena tu nirdeshaha, Tasmat, Mamsadi, Ashrayato, Marmani. Bahulena tu nirdesha means these five are the particular structures or the anatomical entities where they will that those entities will come close together. But among those five entities, any one is bahulyata means predominant. Either there may be the mamsa predominancy, either the sira predominancy, or the snayus are more in number, or asthis are more in number, or it may be the sandhi. So that is called that region is to be called as a marma pradesha. So these are the different quotations explained by the Ashtangradayakara, or also Sangrakara definition is also there is explained. Even the Charakacharya has also quoted, but I was picked up only the few of them, which is very easy to understand and very easy to remember for us. And these are clear-cut explanation given by our acharyas, the definition of an marma. So and this concept is to be understood as a marma. So once again, I will briefly I will tell you what is the nirukti. Bru, that is here the word ma means the prana or the vayu. Again, everybody knows vayu. Vayu means the here we can say the either vata. It is to be vata do vataha. So that vatas are again of fighters. Prana udana samana vyana paramak. That one prana. That means the life of an individual where and the refa means the seat. The marmaha is the seat of an prana or the vayu. So that's why this is to be called as a nirukti of an word marmaha. So again, the definition already I was told you here. The junction of mamsa, siras, nayu, astis and the sandhi is called as a marma. So here, why I am telling you the next line I was written here. It is also known as pranayatana. Why I was quoting you? Because the copy the topic which is allotted for me is a concept of three marmas. So here the word pranayatana was used. Why? Because Charakacharya is the only acharya who has explained the concept of three marmas. Yes, he was quoted there are the 107 marmas, but he has emphasized more on the three marmas. What are the three marmas and why he has given the importance to those three marmas, that we'll study later on. And again, he has named these marma places as a pranayatanas. Okay, so he pranayatana, he has explained the Charaka Sutrasthana 29 chapter, complete one chapter he has devoted under by giving the pranayatani, Dasha pranayatani adhyayam in the Charaka Sutrasthana 29 chapter here. So here pranayatana, ayatana means the location or the ashraya, isn't it? The word, you can split the word prana and the ayatana. What is the prana and what is the ayatana? Already we discussed prana is nothing but the life of an individual. Okay, so what is the ayatana? Ayatana is the place where the we can say it is the ashraya. It is the ashraya for the prana. So that's why he has used the word, synonymous word for the marma as a pranayatana. So that's why we can say the marmas are also called as the pranayatana. Like that, Charakacharya has quoted totally there are 10 pranayatanas. What are those? That is not a part to discuss here, but just we should know what is the pranayatana, how they are. They are in 10 in number, explained by the Charakacharyas. These are the different definitions explained by our Acharyas. What the definition here? Point and is defined as an anatomical site where the muscles, nothing but the mamsa, veins. Here, we should not use the word veins, but I was kept here. Why? Because to clarify the concept, siras are nothing but the, we can take the blood vessels. That may be the arteries, that may be the veins. Understood? So that's why the word here we can clarify, that is the siras. The commonly as used the term blood vessels, we can use here the ligaments, then the bones, that is the asthis, and the sandhis, that is the joint. Where these all anatomical structures comes close together, those point of a human body is called as the marma. And like that, such 107 marmas on the human body have been told by the Sushrutaracharya, and he has explained separately all the marmas. So Ashtanga Hridayakara has explained these are the points where the important nerves keeps together along with the other structures like again Mamsa, Sira, Asthi, Snayus, and Sandhis. So such those places on the human body are called as the marmas. And also he has explained the 107 marmas like the Sushrutaracharya. But here the third quotation which has been explained by the Charakacharya is he has explained 6 major vital points of the human body in the Charaka Sharir Sthana 7th chapter as Murdaha, Kantha, Hridaya, Nabhi, Uda, and the Basti. These are the 6 major vital points, Rachanatmaka vital points explained by the Charakacharya, and these 6 vital points he has quoted in this quotation as the Mahamarmas. Along with these 6 points, he has also quoted the other 4 entities, but those were and combined these 6 and those 4, he has given the heading for those 10 entities as the pranayatanas of the human body. Understood? So like that, Charaka Sharira, also Charak Sutra, in the 2 different places, Charakacharya has given the reference of the pranayatanas. As the Charak Sharira explained about these 6 places, along with the 4 other places, like he has explained the Ojas, Shukra, Rakta, like that the other 4 things he has added along with these 6 and he has quoted as a whereas Sharira, 6th Charak Chikitsa 26th chapter, the Charak Siddhistha Charak Chikitsa 26th chapter explained the 3 major points, that is Sura, Siras, Hridaya, and the Basti, which are called as an 3 marmas, which are also called as an 3 marmas in the Charak Chikitsa 26. Again, one more reference has been given by the Charakacharya in the Charaka Siddhisthana, Charak Siddhisthana 9th chapter, that is where he quoted that the 3 marma, he has explained the totally, he has given the just number, that is total 29 marmas are there in the 3 marmya Siddhi Sharira. That is, sorry, 3 marmya Siddhi Adhyaya in the Siddhisthana 9th chapter, where he has explained, he has given the number on the human body. There are totally 107 marmas are present, but among the 107 marmas, the prime marmas he has given importance as the Shiras, Hridaya, and the Basti, and he has given the name for these marmas as the 3 marmas. So, after studying the definition of a different acharyas, what the classification has been did by our acharyas of the marmas. They have been classified based on the different basis, that is based on the rachana. The rachana means based on the involved anatomical structure. That is already we discussed the definition. Based on that only, Rachanatmaka classification of a marma, they have been classified under the 5 categories. That is Vamsa marmas, Sira marmas, Snayu marmas, Asti marmas, and the Sandhi marmas separately. On the basis of Shadanga Sharira, that means where they are located. On the location wise of the human body, they have been called as the extremity. That is Shakhagata marmas, thorax, Urogata marmas, abdomen, Udaragata marmas, and the supraclavicular, Urdhvajatrugata marmas. So, based on the anatomical location, the marmas have been classified on these different places of a human body. Next classification has been did by all the acharyas based on the parinama. That means when there is an injury or the aghata to that particular marma, what it will leads, what it will causes. For example, some injury to some marmas that may lead to the death. Some injuries, some injury to the any other marmas may cause the functional deformity. Some injury to the other parts may lead to only the painful condition. So, based on that only, the marmas have been classified as the Sadhya Pranahara marmas, Kalantara Pranahara marmas, Vaikunta marmas, Vishalyagna marmas, and Rujakara marmas. So, this is the broad classification accepted by the almost all acharyas. But here, one more we can see the Vagbhatacharya has been added one more marma, one more basis for the class, one more uh, Marma under the heading of an Rachanatmaka or the involvement of an anatomical entity in the heading of the Rachanatmaka classification. As Sushrutaracharya explained, Mamsa Marmas are 11 in number, Sira Marmas are 41 in number, Snayu Marmas are 27, Asthis are 8 and Sandhi Marmas are 20. Like that, totally 120, 107 Marmas have been explained by our Acharyas. Whereas Vagbhatacharya has added Dhavani Marma as, and he has given the, he has also changes the numbers of an marmas given by the Shishrutaracharya. As Sira marmas he has explained the 37 in number, whereas Shishrutaracharya has given the 41 Sira marmas. Snayu marmas he has explained the 23 Snayu marmas, whereas Shishrutaracharya has given the 27 number of the Snayu marmas. Asti marmas Acharya Vagbhata has added 8 marmas, same number has been given by the Shishrutaracharya. Sandhi Marmas by the Vagbhatacharya is the 20. Also, the Shrutaracharya also given the 20 numbers for the 20 are the Sandhi Marmas. Whereas Mamsa by Vagbhatacharya, Mamsa Marmas are 10 in number, whereas the Shrutaracharya has given the Mamsa Marmas are 11 in number. Whereas one more structural classification added by the Vagbhatacharya as the Dhamni Marma, and he has given the total 9 Dhamni Marmas are located in the human body. So, like that, this is the brief classification given by the our acharyas. So, after the classification of these marmas, they have been subdivided. For example, according to the site or the Angabhedana, that is the regional classification. They have been classified as the Shakhagata marmas are 44, Poshtagara marmas are 3 in number, Prushtvamshagata marmas are 14 in number, Urhogata marmas are 9 in number, and Urdhvajatragata, or we can say the Urdhvanga marmas are 37. See, among these all the classification, why I am dealing here the classification? Because here the Charakacharya has given that this reference is essential when we'll deal with the three marma concept. So that's why I'm going through this number of the classification along with the numbers of an marmas. So like that, our Acharya has told, Sridharacharya has given the 107 marmas as an Anga Bhedena. Next classification, Nimesha Bhedena classification. That means the structural classification of an marmas. Mamsa marmas are 11, Sira marmas are 41, Snayu marmas are 27, Asti marmas are 18 number, and the Sandhi marmas are 20 number. So, next is the Vyapata Bhedena. That means according to the prognosis or the Parinamaja classification. That means what Aghata of that particular region, that what it will cause us based on that. Based on that only, our Acharyas have classified as Sadhya Prana Marmas, and Shrutaracharya added 19 Sadhya Prana Marmas on the human body, 33 are the Kalantara Pranaharas, 3 are the Vishalyagnas, 44 are the Vishalyakara Marmas, and 8 are the Rujakara Marmas. Like that, again, the number is came 107 Marmas. Okay, next, Manabhedena classification. This classification I was missed in the chart. So here we can see the dimensional classification or the Pramana Bhedena. Based on the Pramanas, Acharya has been classified as the Ardhangula Marmas, Ekangula Marmas, Dvayangula, Trayangula, and Panitala. Ardhangula marmas is the just half of the anguli. So totally there are 56 ardhanguli marmas. Ekanguli means complete one angula pramana. That those are 12 in numbers. Okay. Dvayangula marmas means the marmas which have the two anguli pramana. Those are 6 in number. The three anguli marmas are 4 in numbers. And panitala. Panitala means the own palm like this is the called as a pani. So this is the panitala. So this region is to be called as a Panitala region. So totally 29 are the Panitala marmas have been explained by our acharyas. And again, the number came to same, that is 107 marmas. Next will comes the numerical classification or the Sankhyanusar classification. This also I was not kept in that classification. So based on the numerical this ekangula dvayangula marmas again. So ekangula marmas are 6 in number, dvayangulas are 52, chaturangula marmas are 36, panchangula marmas are 5, and panital marmas are 8. Like that, totally there are again the number escape for not 7 marmas. So this is the classification of an marmas based on the anatomical sharirasar anatomical location of the marmas on our body, structure classification, parinamaja classification, pramanas classification, and the numerical classification. So after the completion of this one, what is the marma and what the marmas will, what the marmas are the seat of which particular human entities in marmas are the seat of which, what are the structures or what are the entities which are present in the marmas. So Acharya Sushruta has been explained in the 6th chapter, that is Soma Maruta Tejamsihi Rajaha Sattvatamamsi cha Marmashuhu Prayasha Pumsam Bhutatma cha Avatishtate Marma Swabhihastasta Annam Jivanti Shariranaha. That means the marmas are the seat of Somaha, Marutaha, and Tejaha. Again, what is a Soma? Already everybody knows Soma is to be considered for the liquid entity. Again, when you go with the three doshas concept of human body, Soma is to be called the predominant of a Kapha dosha. So here, marmas are the place of a Kapha dosha. Marutaha, the word itself clear, it is a synonym word used for the Vayu, or also we can say the Vata. And already we discussed the Pranavata is located. So it is also the place for the Vayu. Next, the word is Maruta Tejaha. That means the Agni we can say here. And in the when we see the qualities of an dosha, we can say the Pitta is a dosha, which is how the predominancy of an Agni, or we can say the Tejas. So like that, all the marmas will have the dominancy of the three doshas, Vataha, Pittaha, and the Kapha doshas. Not only the three doshas, marmas are also places, the Triguna places, Rajaha, Sattvatamam, Sichaha. So commonly we can say to these are the mind or the manas. See, unless and until the manas is not there, manas is not located in that marmas, we can't feel the pain-like sensation. So that's why essential factor to form the marmas or the one of the important entity which is present in the marma as the manas. So these are the different entities along with the Panchamahabhutas. Already everybody knows that is Bhutatma, Sarvadravam Panchabhautikatvam. Sharira is completely made up of the Panchamahabhutas. So it is not a divide of Panchamahabhutas. What are those Panchamahabhutas? Vata, Vayu, Jalaha, Akasha, Prithvi, and Agni. So these are the Panchamahabhutas which are located, which are also present in that particular marma. So we can say marma is the seat of three doshas, Vataha, Pittaha, and Kapha. The three gunas, which includes Sattva, Rajas, Tamas, which is the indication of our manas. So here, three gunas, we can't say the Sattva, Rajas, or Tamas, but these are indication of the location of the mana in that particular region. So that only we can feel the feelings, or we can feel the painful, like dreadful conditions which will leads by due to the aghataja to that particular place. Next is the Panchamahabhutas. So Sarvadravam Panchamautikam. This is the quotation everybody knows. In the, when we enter into Ayurveda fraternity, we first definition which we'll study in the Rachana or Padarthana is Sarvadravam Panchamautikatvam. So Sharira is made up of an Panchamahabhutika. So like that, the marmas is also the place for the Panchamahabhutas. So marmas have been made by this all the physiological entities in the human body. So those are the anatomical entities, and we can say these are the Kriyatmak or the physiological entities located in the Burma place. So after discussing these points, next we'll discuss just the prognostic type of an marmas with the related Mahabhutas. See, the prognostic, that is the Agha period which I was told you. So this is the basic classification, a very important classification, why the Charaka concept has been given for the three marmas. So here the classification is made on the Aghataja Pranama. First classification is Sadhya Prana marmas. This type of marmas will have the predominancy of Agni Mahabhuta. this marmas will have the predominance of an Agni Mahabhuta. So that's why, as everybody knows, Agni is a prime important factor to run our physiological function of the human body. When there is an interruption of an Agni, so that definitely may lead to a dreadful condition to the either change in the physiology of a human body, or sometimes there may be the death also. So that's why the Sadhyapranaratva, why these marmas have been called Sadhyapranaratmas, because there is a loss of Agni directly leads to the death. But here, one concept also clear, the duration of a death, we can say sudden death. So commonly we can say the sudden death concept for Sadhyapranaratmas. But if the after the injury, if death will occur within the 7 days, so that's why these marmas are called as a Sadhyapranaratma. To be clear, this concept. Everybody, we just commonly we can say the pranarmas means the injury, so that marma leads to the sudden death. But among those of the pranarmas, some marmas are there which are where the injury to that particular region leads to sudden death also, but with some different clinical, when the body will enter into different clinical conditions. So that's why the death may occur within the 7 days. Next, kalantar pranahara marmas. Again, here also the pranaharatva is there, the death is there, but because Agni is present along with the Soma. Agni is present along with the Soma, that is a kapha, or we can say the liquid entity. So that's why that Soma withholds the prana for some time. That Soma is essential, that Soma will work here to hold the prana for the some time. But again, if that condition is not treated, those that may also lead to the death. But here the death is not a sudden or within 7 days. The duration of a death, time of a duration of a death may also exceeds more than the 15 days. So death due to the immediate loss of an Agni and the gradual loss of an Soma. Agni will goes, but Soma will goes silently or gradually loss of Soma or the liquid entity or kapha, that may lead to the death. But here the duration for the death is prolonged one. Next, we have been expect Vishalyagna Marma. Here the location is the Mahabhuta which is predominant in this Marma is the Vayu Mahabhuta. So here death due to the escape of Vayu with the extraction of a foreign body. Vishalyagna. Shalya means the foreign body. Vishalya. The Shalya. See here, one example I will put here. If any thorn will prick to our fingertip of finger, we will feel the pain till the extraction of that thorn from our any part of our body. So what we'll do, we'll try to pick up that thorn, and after removing of the thorn from our body, we will feel the painless. So though that particular feeling is to be known as a vishalya, that is the pricking of an even foreign thing or foreign structure to the human body. So till that foreign structure is located in your body, our prana is there. But as soon after removal of that shalya from our body, there may be the chances of death. If that particular shalya or the foreign body will injure to the vital structure of the human body. That is also essential for you here. If any foreign, that is shalya, that will injure directly to the heart. So if you remove that one, the chance there may be the chances of death. So that's why. But death is due to the escapism of Vayu from that particular place. If it will that particular Vishalya will keep here, the Vayu will withhold the prana for some time. Again, that those marmas are called as a Vishalyagna marmas. Next classification they have given the Vaikhalyakara marmas. Here, the location of the Vaikhalya marma is predominant of an Soma or the Jala Mahabhuta here. Vaikhalyata. Vaikhalyata means disability, we can say the functional loss or the functional deformity. That is a Vaikhalyata, we can say. Any injury to that particular place may leads to the functional deformity. So that those marmas are known as a Vaikhalyakara marmas. Next, the last marma, they have been explained Rujakara. The word itself clearly explains Rujaha. See, every marma has the meaning in the name only. Sadhya pranahara. Sadhyaha. The pranahara. Hara means loss of prana. Immediate loss of prana is the sadhya pranahara. Kalantara. Pranahara. The loss of prana is there, but kalantara after kala, time, after some time. That is a kalantara. Vishalyagna. Visha. The how the poison will cause the poison, entry of an poison, intake of an poison will not cause the immediate death. It will, the death will occur gradually. So like that, any shell, the causing just work like a poison in your body. That's why it has been a Vishalyagna. Vaikalya means the functional deformity. That is the Vaikalyakara marmas. Deformity is there, but functional deformity. That is the Vaikalyakara marmas. Next word used for the Rujakaraha. That is Rujaha, pain. Karaha, the marmas which will cause the pain. Those marmas have been called as a Rujakara marmas, in which the Agni and the Vayu Mahabhuta is predominant. Here there is a only a painful condition is there. So those marmas are called as the Rujakara marmas. So this is the prognostic type of an marmas with their predominance of an Mahabhutas. So after discussing of this one, next we will enter into the what is the Trimarma explained by our Charakacharya. So, sir, already we know this all the structures. Why we are discussing that this the prognostic type of an marmas here. So this is very important, or it is the continuation of an Charaka's three marma. The three marma word is the three word is nothing but the numer. This is the numeric term or the three. The word three denotes the numeric. It is a worthy to not to know. That is in the past of the numerics, like we are going to use the 3, 5 for the panchats, 7 for the saptas, and odd digits had a great importance than the other digits, numerical digits in the classics of an Ayurveda. The reason after such liking still remains a mystery, but it has remained a Vedic approach to point out important classification by such types. Means we don't know why they are used the word 3, 5, 7. All the odd numbers they have been used for the classification. The mystery behind that one, that is a still it is a question mark, but they have been given. So like that, three marmas was the one of the important, or the we can say the peculiarity of an Charaka Samhita. Everybody knows Charaka is the Acharya who is Chikitsa Pradhana Acharya, or we can say he has given the prime importance for the treatment aspect rather than the surgical approach. So, because of that only, he has given the Trimarmiya concept. Understood? And also, he has explained the diseases of the Trimarmas and also the treatment which we have to treat to that particular three marmas. So Charaka also accepted the existence of 107 marmas. He has not ignored, or he has not explained the only three marmas. He has also told the numerical number. Yes, there are the 107 marmas as Saptottaram Marmashatam. Yaduktam Shariram Sankhya Adhikrityam Teshu. That means there are 107 marmas are located in the human body. But Marmanihi Basti Hridayam Shirashcha Pradhana Bhutyo Nrupayo Vadantihi. Here, among those 107 marmas, Basti, Hridaya, Shira are the Pradhana marmas. And that's why those marmas are also called as the Mahamarmas. Those marmas are also named as the Mahamarmas, and he has given the prime importance to this Basti, Hridaya, and Shira, and complete one chapter he has devoted as the three Marimiya Siddhi in the ninth chapter of Siddhi Sthana Charaka Samhita for the three marmas. In that chapter, he has explained the diseases which are causes to these three marmas along with their treatment aspect. So why anatomically these marmas are important, that we will discuss here. And also, one more reference we will see by the medical jurisprudence of an modern peoples, what they have told, the trifords of an life. Among the trifords of an life, they have been told the life of an health is totally dependent on the proper action of the three organs of the human body, that is heart, brain, and the lungs. Heart, brain, and the lungs. Our concept is also Shiras, Hridaya, and the Basti. Shiras, Hridaya, and the Basti. We can say Shiras for the brain, Hridaya is the heart. Only the difference of opinion we find here, that is modern jurisprudence people will explain given the importance for the lungs, whereas our people has given the importance for the Basti. So in the modern jurisprudence we find the trifords of a life are called as, are why they are called, because the total life and the health is dependent on the proper functioning or action of heart, lungs, and the brain. So that's why these are called as trifords of an life. So these are the three marmas explained by the Charakacharya, that is Shiras, Hridaya, and the Basti. Shiras, completely Shiras is to be called as the, we can take anatomically, we can say the organ which is located in the cranium of a human body, that is the brain. So that is the Shiras. Hridaya, Harati Hridayam, the complete definition of a Hridaya is totally, we will see, that is the, we are completely correlated with the Hridaya, with the heart, and the Basti, that we are compared with the urinary bladder. So that's why the brain, the heart, and the Basti, these are called as the three marmas. Then we'll see the Shiras, Hridaya, and the Basti. Next we'll discuss one by one. What is the Shiras Marma? Why the importance has been given for the Hridaya Marma, and why the Charakacharya has given the importance for the Basti Marma other than that of an 107 Marmas. So, first we will discuss the Shiro Marma. First we will discuss the Shiro Marma. Shirasi Indriyani Indriya Pranavahani Protamsi Suryam Eva Bhagastayaha Samsritani. It has been explained in the Charaka Sharir, the 9th chapter. Shirasi Indriyani Indriya Pranavahani. Shiraha is the marma, the head, the region head. Indriyani Indriya Pranavahani. So here every particular word we have to stress on individual word. We will find the importance of it. Shiras. Indriyani, it is the marma, or it is the place where all the indriyas. What are the indriyas? Those everybody the pancha jnanendriyas means the functioning of an five sensory organs, which will, or the shiras will controls all the functioning of these five organs. And also along with that one, it is also present. It is a place for the pranamahani srotamsi. So the word here explains pranavahani srotamsi. The pranava srotas, it will also control the functioning of a pranava srotas. How? He has given the simile, that is Surya. How the sun will controlling the complete the functioning of a universe in day routinely, like that our shiras will control all the sensory organ functions and also the functioning proper functioning of a pranavaha srotas. So that's the prime importance. So that's why the prime importance has been given for the shiras. Understood? Whereas again Charakacharya himself has told Pranaha Pranabhutam Yatra Shritaha Sarvendriyahani cha Yaduttam Angam Angaram Shirastate Diyate. How he has defined the Shiras, very beautifully has defined the Shiras as Pranaha Pranabhutam Yatra Shritaha. Ashritaha, that is the word Ashraya for Pranaha, and the Prana, that is the life, it is a place for the life, and also the Sarvendriyas. All the indriyas, word use, sensory, sarvendriyas. Again, when we'll see the indriya concept he has given, sarvendriyas includes all the sensory organs and all the motor organs. So it is a place for the, means a place for the prana, and also it will controls the functioning of all the 11 organs, which includes sensory organs, motor organs, and the manas. Panchindriyas, Pancha Dhanendriyas, Pancha Karamendriyas, and one more Indriya explained by Rachana, that is the Manaha. So it will controls all the functioning of all these Indriyas. And also, next line is beautifully Yaduttam Angam Angaram. In all the Angas, Uttamaha, it is prime important. It is the most important organ in the all the organs. So that is called as the Shiras. The organ or the anatomical structure which is the place for the pranaha, which will controls the action of all the 11 indriyas, sarvendriyani, all the functioning of all the indriyas, and also it is a place, or it is the we can say uttama in all the angas. That anatomical structure or anatomical entity, we can say the shiras. So this is the location and the definition of an shiras by the Charakacharya. So everybody knows the head. This is the head region. So in Ayurveda, Shira is having the prime importance among all the organs of your body. Yes, I was told you Angam Angara. Why? Because it possesses the criteria to be included in the three marmas, and it has, along with the three mar, it is the most important organ or the important structure in the human body. And also, why Charakacharya has given the prime importance? When we will see the Shrutaracharya's definition of Urdhva Chaturagata Marmas, he has told the marmas which is located above the region of neck, those are called as Urdhvajatrigata marmas. So that's why when we compare the Charaka's concept of three marmas and we will compare the Shrivata's concept of an marmas. So when we mix up these together, so among the 107 marmas, 37 Jatrujagata marmas are located in the Shiras. Totally 37 Jatragata marmas are located in the Shira Pradesh, or all the Urva Jatragata marmas are located in the region of a head. And among these 37 Jatragata marmas, 19 or 17 are the Sadhya Prana marmas. Are the Sadhya Prasi? Why the Charaka has given the Shiras as the importance, and why how the Acharya Shishupta has given the importance to the Shiras is by explaining the Urvajatragata Marmas. Acharya Shishupta also given the importance for the Urvajatragata Marmas or the Shiras by explaining the term as the Urvajatragata Marmas, but Charakacharya broadly explained the word Shiras. So among the 107 marmas, 37 marmas are in the Shira located on the Shira Pradesha. And also it is considered as Uttamanga, that is supreme. Why? It is an important and a major part of the body. Why? Because it will controls all vital organs of the human body where the prana is located. For example, brain is the organ which is the most vital organ and which will control all the human physiological activities of a human body. When we'll see the modern anatomy or the modern physiology, because brain already number of guest lectures have been conducted in this series. Already we discussed or you are observed the different functional areas, functional aspect of a cerebrum also told, the spinal cord also told. In that we discuss or we have seen why how the importance of a brain is there and how it will controls all the sensory and the motor activities of a human body. So our Acharya has given use the word prana for all these things, and they have used the sarvendriyas. It will controls all the activities of an sarvendriya, so all the indriyas. So that's why it is called a supreme or uttamanga when will as compared to the other angas of an organs. All the sense organs and the channels which will carry the sensory and the vital impulses from the shiras are like the rays of from the sun. Just in the previous in this quotation, we discussed that in Surya Mivam Bhagastayaha Samsritanihi. How the sun will controls the activities of a universe by passing the sun rays, like that by locating Shiras in the Urdhva Pradesha. In the Urdhva Pradesha, it will passes the like rays, it will controls all the activity of a human body through the different strotasas or through the different channels. Isn't it? So simile has been given Suryam Evam Bhagastayaha. How when we are sitting on the earth, sun is located just the above, like that in the sky, like that Shiras is the organ which is located in the upper part or at the supreme region of human body, and from here it will controls by passing the different channels, and through that channels it will controls all the activities of a human body. So that's like that our Acharya has given the importance to the Shiras. So this verse, this particular shloka is truly signifies as the Shiras as a three marma when we'll compare with the brain. And also all the minor injuries to any simple minor injury to the region of our head may also leads to the disastrous symptoms. Disastrous symptoms may include sometimes the death not may occur, but the person may go into the coma-like conditions. Means the only the vital activity, the person will the respiratory vital function will start, but the functionally or there is a complete loss of function. So that's why our Acharya has given the prime importance for the Shira Pradesha. Again, Shiras Indriyani, and just only this quotation I was told you. All the sense organ and the channels carrying the sensory and the vital impulses from the Shiras are like the rays from the sun. So, which will completely, which signifies the importance of Shiras in the as compared with the other marmas of a human body. So it is a completely when you broadly classify this marma, we can't say the particular measurement now. We can't define the measurement of this marma, but it is been included in the Sadhya marma. It is located above the neck region. It is a place for the pranavayu, alochak pitta, and the tarpaka. We will see the kriyatmaka point of view, and also what will leads any injury will occur, either functional disability, and sometimes due to the intracranial hemorrhage there will be the death, or there may be the coma-like condition, syncope, and lastly the death may be the final condition of a human body. So this is the Shira Marmas. So just I was told you, among the 107 marma, Shira is the place which will give the location for 37 marmas. What are those 37 marmas? See in this diagram, the 37 marmas are located in the Shira Pradesha are Adhipatihi, Simanta. I am going top to bottom. In this diagram, I am moving from top to bottom where my cursor is there. That is the Adhipatihi, Simantaha. This is the location of Stapani Marma. This is the Avarta. Adhipati at the center of our cranium. We can say Simanta, sutures. The 5 sutures are there. So those are the Simanta. Stapani is the Marma which is located in between the eyebrows. Where we will put the gandhas or like the things. So that Marma is called as Stapani Marma. So next will comes the Avarta Marma, the location of an Avarta Marma at the center of an eyebrows. We can say the Avarta Marmas. Utkhepa, just abreast besides the even ear auricles, we can say the Utkhepa. Next, Thapani Marma. Sorry, this one. Shankhamarmas, that is the regions just beside to the near to the temporomandibular joint, we can say the Shankhamarmas. Next we'll spell the Apanga, just at the end of your eyebrows, that is to be called as an Apanga Marma. Phanamarmas, on the either side of your nose, we can take the Phanamarmas. And Nila, Manya and Siramatrikas, these are the blood vessels which are present in your neck region. So those are called as the Nila, Manya and Siramatrikas. Like that, we will see the total 37 marmas are located in the Shira Pradesha. So by seeing this one, we can say why the Acharya has given as the importance the Shira as the marmaha among the 3 marmas. So in this diagram, the diagram which is present at the side also, we can see the anatomically we can see the marmas located in that Shira Pradesha. So this is the Simanta, the suture-like structure here. In the diagram we can see the sutures, that is the Simanta Marma. The center of a cranium, that is Adhipati Marma. At the center of an eyebrows, we can say the Stapani Marmas. At the end of this one, that is the Apanga Marmas, Shankha Marmas. These are the Nila and the Matrika Marmas. In the Kanta Pradesh, we can see the Ashtanilas and the Matrika Marmas. These at the sides of a nose, we can see the 2 Fana Marmas are located. So these are the locations, anatomical locations of an 37 marmas in the region of an Urdhva Jatrugata or in the region of an Shira Pradesha. So how they have been 37? Totally 8 are the Dhamani marmas, 4 are the Dhamani marmas, 8 are the Matrikas, 2 Krakatika marmas, 2 Viduras, 2 Fanas, 2 Apanga marmas, 2 Avartas, 2 Utshepas, 2 Shankha marmas, 1 Sthapani, which include the 5 Simantas, 4 Shangatakas, and 1 Adhipati. So like that, totally 37 marmas are located in the Shira Pradesha. In the next, I will tell you how among these 37 marmas, how many are Siddhapranaras, how many are the Kalantaras, and how many are the Vishalagna or the Vaikalakara marmas. Among these 37 marmas. So see here, among the these 37 marmas, Dhamani marmas are to be called the Vaikalakara marmas. Matrikas are Siddhaprana, Ashtamatrikas are the Siddhaprana marmas. Krikatikas are the Vaikalakaras. Viduras are also Vaikalakaras. Pranamarmas are also Vaikalakaras. Apanga are the Vaikalakaras. Avartas also Vaikalakaras. See here, that's why I was told you where the word Vaikalakaram comes, that is that the region or the Vaikalakara define the deformity that particular region may lead to the functional deformity. So any injury to this among these marmas that may cause the functional, either it may be the permanent or it may be the treatable. So that is the Vaikalakara marmas. Next will come the Vishalagna. Among that, the 2 Utshepas are to be considered Vishalagna marmas. Why Vishalagna? Again, the definition of Vishalagna marmas we discussed. That is any foreign particle or a foreign structure which will injure to that particular region till that particular foreign particle is located in that region. Our life will be there. But soon after the removal of that particular foreign things, that there will be the chances of death. So like that, the 2 Utshepas are to be considered the Vishalagna marmas. 5 Simantas are called the Kalantara Pranavarma. That means any injury to that sutures that may lead to the Kalantara. Agar if suppose that injury is the deep rooted injury, that may be the due to the if that injury is deeply formed to that cement or the sutures, what will occur? There is an we can say bleeding or the hem that breaking of a blood vessels which are located just below the cranium, and that may lead to the we can say the intracranial bleedings, or also we can say the the just below that our cranium or the just below the our skull bone we'll find the meninges. So there are the chances of an infection to the meningitis may occur. So that may lead to the kalantara, that in this particular physiological or the pathological condition, the death not may occur. Sudden death may not occur, but the death may be there, but after some time. So that's why the Simantas have been included under the Kalantara Pranara Brahma. Where are four Singatakas, one Adipati, and Matrikas, they have been told Sadhya Prana Brahmas. Here the number has been written wrongly, one number, but there are totally four Singatakas. Okay, so like that is a typing mistake was here in the while explaining the Shingataka Marmas, the number. So like that, totally 19 are the Sadhyapraha Marmas which are located in your Shira Pradesha. So this proves the importance of an Shira Pradesha. So when we'll see this marmas individually, when we'll discuss, there is a, because of a lack of time, I will not discuss all the individual marmas here, but just I will tell you some few examples. Just we discuss the Simanta marmas. Among those one, some marmas are Siramatrikas marmas. Yes, I was showing you the location of these marmas as the blood vessels which are passing through this neck region. So we can take the internal carotid and the external carotid arteries. The damage to this one directly leads to the death-like condition. So that also the cause. The death, sudden death may be the reason for that one. Or sometimes you can say the hanging-like condition. So breaking of our vertebrae, which will cause the pressure on your vertebrae, and that may cause the pressure on the blood vessels, which are passing through which are going to which are supplying to the cerebrum, and because of a compression of that particular blood vessels, our sudden stoppage of blood supply to the brain, which may lead to the death. So that is the importance of Siramatrika marmas. Again, Shankha marmas, the location of Shankha marmas, the temporomandibular joint. From that also the blood vessels will moving to the cerebral cortex, and that's why the injury to this temporal region may also to the leads to the death. So that's why these marmas, the injury to this particular region may lead to the death-like condition. So this proves the why the Charakacharya has given the prime importance to the Marshira, or he has quoted, instead of explaining the 37 separate marmas, he has totally given the importance to the Shira. Completely, elaborately, broadly, we can say that Shira is the one of the important marma, which will prove here by seeing the anatomical importance of these individual marmas. Okay, so what the individual features will occur to the Shira marma will lead to the Manyastamba, that is a spondylosis condition like Ardhita paralysis condition, giddiness, that is Tamam Pravesha, squeezing type of pain, loss of motor functioning, loss of sense, different diseases of like memory loss, and lastly the death. Among these, when we see the injurical aspect of these marmas, why we are taking the Manyastamba like cervicals, because Krikatika marma is located at the back of your neck. That is to be considered, that is the cervical vertebrae may comes. So an injury to this region may lead to the functional deformity of your neck, means you can't move your neck here and there. Just we have to keep our neck in the steady position. Again, Shankar, that is the Ardhita-like condition. So some facial paralysis. So sometimes injury to the facial region, facial nerves are passing to the facial muscle. So that may lead to the loss of functioning of a facial nerve leads to the loss of functioning of facial muscles. So that may lead to the facial paralysis like condition. Tama Pradesha, we can observe very commonly this one by by moving our head downward and moving. We are crossing moving in the room, and suddenly any wall will come, so will hit that wall will hit to our head. We directly what we can observe, just we will find a blackish darkness in front of your eyes for a few of second, friction of the second. So that's it, Tama Pravesha. Understood. Some leads the loss of motor functioning, because loss of sensory function and a lot of loss of motor function. Everybody knows cerebrum is the major part of your brain which will controlling all the your sensory functions and the motor functions. So any injury to that particular region may lead to the loss of sensory function and the motor functions of your body. And lastly, one more important organ, this one system is present in your cerebral cortex, that is the limbic system. So that's why any injury to that, the deep injury to the brain or the head region may also leads to the injury to the limbic system, which may cause the loss of memory. And sometimes, if such things will not occur, lastly the death is the ultimate by the if the injury is so deep one. Understood? So deeper injury to the head region may also cause the leads to sudden death-like condition. So that's why this will tell you why the anatomical stress is important and why the death, why it has been explained under the heading of a three marmas by the Charakacharya. Okay, next marma is the Hridaya marma. Next marma is the Hridaya marma among the three marmas. So this marma, first time the Hridaya will find the references in the different Upanishads and all those things. I will not go in detail about that thing. Just I will give the location of this marma, that is Taniyor Madhyam Adhishtayor Amashay Dwaram Sattva Rajasthamadhishtanam Hridayam Nama Tatrapi Saddha Evam Marnam. Sushrutacharya Ashtangradayakara also explained Hridaya as the marma under the heading of a Saddha Pranana marma. The location of this marma, our acharyas have been told, it is located in between the two breasts and above the cardiac end of a stomach. That is Stanayor Madhyaha. The marma which is located in between the two stanaya, two stanas, that is the breast region. Adhishtanam Urasya Amashaya Dwaram. That means the marma which is located Urasya Amashaya Dwaram. What we can say? Uraha, Urasya Amashay Dwaram, cardiac aid. Ura word used for our thoracic region, or modern people will tell you the cardiac end of the stomach. So that is very clear cut. Urasya Amashay Dwaram, the marma which is located in between the two stanas and also just above the Amashay Dwara, cardiac end of a stomach, and which is the adhisthana for the Sattvaha, Rajaha, Tamaha. This is the adhisthana for the that marma is called as a Hridaya marma. The marma which is located in between the two sthanas and just above the cardiac end of the stomach, and which is adhisthana for the sattva rajas and the tamar. That's marma we can say the Hridaya marma. And any injury to this marma leads to sadhyah maranaha. So by seeing this one, we can say what are the structures are involved in this region. We will anatomically we will take the pericardium with the heart, with the coronary vessels, phrenic nerve, and the cardiac plexus. So we can say the complete heart along with the pericardium is the Hridaya marma. So, which is the important organ? When we'll go and detail about the Hridaya or heart, it is so detailed, so I won't explain in detail about that one. So, heart is an important organ, both anatomically and physiologically, which will pumps the blood, which will function, the vital function which is present in your mediastinal cavity in the thoracic region. That is the importance of an heart. Anatomically being the root of an all the Ojavashira, that is the Mahaphala and the Mahamula. Different acharyas have been told that the Hridaya is the place as the Mahaphala and the Mahamula, because it will controls the Ojavasiras. And physiologically, all our classics have been told that Hridaya is the Chetana Sthana. It is the place. That's why our Acharya Shushruta also told Sattva Raja Tama Adhisthana. That indicates it is the location of an Manaha, and Mana is to be considered as a Chetana Adhisthana. Why Chetana Adhisthana means any Chetanata, any function we will feel through the mana. So that's why it is called the Chetana Adhisthana. So by saying this one, we can say it is then considered clear cut. It will give the clear cut picture for us. That is, the site of an Hridaya marma is given for the Hridaya, which is located in the your cardiac your thoracic region. So this is the location of an cardiac Hridaya we can see here in this diagram. Next, it is a measure when we see the classification of this marma by our acharyas by measurement of the pramana. We can say it is Chaturanguli pramana marma, it is a siraha marma, it is a saddhaprana marma. When we'll classify this marma by the this one anatomical structure classification, whether sira marma. So this marma is to be called as sira marma. By the parinamanusa classification, it is to be included under the saddhaprana marma. Pramana classification, it is Chaturanguli Pramana. The location of this marma, uragata marmaha, the and the seat, it is a location for the sadhaka pitta, vyanavayu and avalambaka kapha. And if it will injured, that may it will severe hemorrhage and collapse like condition. Where the Charakacharya has given the prime importance for that one. In the Siddhisthana, he has told Tatta Hridaya Dasha Dhammanya Pranopanoho Manaha Buddhis Chetanam Mahabhutanam Mahabhutani cha Abhyam Ivaha Pratishtitani. That means Hridaya is the place for the Dasha Dhammanis. So that's why I was told it is the place for the Mahadhammanis, Mahamula, I has told. Okay, Mahamula. It is also location Pranaha, Apanaha. So it is also place for the Pranavata. Pranaha, Panoho, Manoho, Buddhi. That means it is a place for the Pranavata. Apanoho, Manoho, Buddhi. And also it is the location for the Manaha. And it will controls the Buddhi. Buddhi. Chetanaha, Chetanata. That's why our Acharyas has been told it is a place for the Chetanaha, Bhutanam, Mahabhutanam. It is a place for the all the Mahabhutas, and by that only this is the considered as the Hridaya. So this will prove the importance of Hridaya as a three marma. Acharya Charaka quotes that it is the residence of 10 important arteries. So in this loka that is Dashadhamanya, Tatra Hridaya, Dashadhamanya, 10 important arteries are located in this Hridaya Pradesha. It is a location for the prana, and up here don't take the Apana Vayu. I was written the Apana Vayu, but here the Apana Vayu is not the location here. Here we can say the Hridaya is the place for the Udanavataha. Urasthanam Udanasyaha. Udanavata is located in prana and Udana Vayu. It is a place for the Manas. It is a place for the Chetanata and the Mahabhutas. So by seeing this shloka only we can say the Hridaya is also one of the important marma among the all the marmas. So that's why any injury to this marma, it leads to the diseased Hridaya. That is our Acharya Charaka has given the different rogas have been explained in our classes, which are to be some of the Hridaya rogas may be treatable, some are untreatable, then that is the treatable, some are treatable with the difficulty, some are totally untreatable, means that may lead to the death like conditions. So any major or minor injury to this place may lead to the fatal condition. So the residence of the mana we can prove the Hridaya as the important Hridaya as the Sadhya Pranara Marma. So what are the Vigata Lakshanas to this region? So Acharya Charakacharya also explained, and also the Shrivitacharya also explained the Marma Vigata Lakshanas as the cause Shvasa, that is loss of all the respiratory problems also leads. Why? Because it is the location of an Hridaya Marma is the chest region or the ura. So by at the side of this ura pradesha also we will have the two more organs, that is the pufusas. So definitely injury to this particular regions may also lead to the loss of respiratory problems. Balakshay, weakness or the loss of immunity. This is the important loss of immunity. Why I was told you, our Acharya has also told it is the controller or it is the place for the Ojava Siras. What is the Oja that will Kriyatmaka point is that Oja is to be considered as Bala of a human body. So injury to that region, Hridaya Pradesh also led to the Balakshayaha. Because Oja Mula, it is our Hridaya is to be considered is the place for the Ojavaha Siras. So that's why injury to that Hridaya Pradesha may lead to the Ojakshayaha. Ojakshaya is why Oja is considered the Bala of a human body. So that's why Oja is to be that's why Marmabhigata to the Hridaya Pradesha will lead to the Balakshayaha. Next, they have told Kantoshvasaha, that is dryness of an throat or any problem in the throat region, because the Hridaya is located in the region of a thoracic region. So any injury to this region may definitely lead to the that dryness of an throat or the problems related to the throat, because the windpipe is also passing just behind the heart. So deep injury may lead to the injury to that windpipe and may lead to the problems present in the throat region. Emaciation of an face and tongue. So definitely there will be chances apasmara, udmada, pralapa, all and the chittanasha, loss of consciousness, or we can take the coma-like condition. Why? Because heart is a region from where all the blood vessels will passing to the which will supplying to the head and to the all the different parts of your body. So that's why any injury to that particular region leads to the death-like condition. So it may be the sudden death or it may be the death after some time by passing to the different condition like coma, syncope, madaha, murcha, sannyas, and the mrityu. These are the stages of a death explained by our acharyas. That is coma, syncope, and the death-like condition. So this is the importance of an Hridaya Marma. The last Marma which has explained by our Acharya Charaka in the three Marmas as the Basti Marma. He has given the importance of an Basti also as the Marma. So Basti stu Sthulam Guda Mushka Sevani Shukra Mutra Vahininam Nadinam Madhe Mutra Hadaroho Ambavahanam Sarve Strotam Samudgam Adhirim Vapaganam Pratishtitaha. Beautifully quoted quotation has been quoted by Charakacharya in the Siddhisthana while explaining the Basti with the location and its function. Basti is the organ or the structure which is located nearer to the Sthula Gudaha, Mushkaha, just above the region of Mushkaha and Sivani. And it is also somehow related to the Shukra and the Mutravahini Nadis, we can say. And Madhe Mutradharo Ambuvahana. It is a Mutradhara. It is the place to hold the Mutra. How it will hold the Mutra? He has to given the simile for that one. Sarve Strotal Samudgaha Adiri Vapana. That means Vapa Ganam. How the sea will collect the water from the different rivers to the different channels. Like that, Basti will receive the water which is oozing from the different places of our body in the place of Basti. So he has given the simile to the Basti with the Samudra or the sea. See comparison how they have compared. Just like a sea, how the sea will receive, see how the formation of the sea will be there. The different rivers keep passing their water through the different channels in that pouring the filling that sea. Similarly, our Basti will receive the water from the different channels of a human body and it will withhold for some time. Then it will passes out through the Mutra Praseka. So that place is called as a Basti region, which is the Mutra Adharaha, which is the place, which is the region for the withhold the Mutra for some time. It is a quotation or given by the Charakacharya in the Siddhisthana 9th chapter 4th sloka. Whereas the Charaka Shushutacharya has given the Basti importance and its location, that is अल्पमांस शोणितो अभ्यंतरतः कट्या पुत्राशयो बस्तिर्नाम तत्रापि सद्योर्मरणम अश्मरी व्रणादितेः तत्र उभयतो भिन्नेन तु यत्नेन उपक्रांतो रोहतिः. That means the organ which is formed by the alpamamsah, it is formed by the small amount of mamsa and shonita. He has explained the formation of Basti, the anatomical structure which are the anatomical entities which are helping for the formation of this Basti. That is, it is formed by the small amount of mamsa and shonita. Abhyantaratah katyam. So just you can take the word katyam abhyantaratah, the organ which is formed by the alpamamsa and the shonita and located in the Kati Pradesha. Abhyantar Katyam Abhyantarata organ which is located behind the Kati Pradesha. That is the Mutrashaya. That is also called the Mutrashaya. The Ashaya for the Mutra. Ashaya means the place where the Mutra is present for some time. That is Bastirnamaha. That organ is called as the Bastihi. So here Acharya Shushruta has given in the same sloka the how formation of Basti, the location of Basti, and why it is called as a Mutrashaya. Understood? Tatrapi sadhyo maranam. So any injury to this region may lead to the death. Sadhyo maranam. Why? Because it may because of an ashmari. We can say the renal calculus, vranadritehe. If any renal calculi may be present or any formation of a vranaha. Vrana means any injury or while performing any surgical procedure to remove that ashmari from that Basti Pradesha, is suppose any accidental injury caused that will to the vranaha, tatra mubhayoto bhinne. Sometime due to the vrana, sometime due to the ashmari, sometime with both. Due to the ashmara, due to the pranaha, yat bhinne hai, yat na to yat nopakranto rohati. after by performing the different prayatnas or by the effort also, we can't save the human life. If any injury will occurs due to the ashmari or due to the vrana or because of both the things, we can't save the life of a human being. That means there is a sudden death will leads to this. If any injury will occurs to this marma of a human body, so that's why it is called as an basti, as the sadhya pranahara marma. So what are the structures are involved in this marma? That is, we can take anatomically, we can take the urinary bladder, lower part of an ureters, superior and inferior vesical arteries, because our acharya has been told in the quotation shukra shukra vahini nam nadihi, superior and shukra mutra vahini nam nadihi, superior inferior vesical arteries, vesical venous pouches, vesical plexus, different parasympathetic efferent fibers, sympathetic fibers, pudendal and sensory nerves, which are supplying to the region of urinary bladder. So here, so all this, when we see the location of our acharya's concept, when we see the anatomically location of this our acharya's of Basti Pradesha, these all the anatomical structures are coming in that location. So by this only we can say these are the anatomical structures which are coming under the Basti Pradesha. So in this diagram, we can see the clear cutly the bladder and its lower part of an ureters. Also, we can see the testes. Also, we can see the prostate and the blood vessels which are supplying to the Basti Pradesha or the urinary bladder. By seeing this only, this marma has been classified under the heading of the Snayu marma. It is considered as Sadhya Pranala marma. It is Chaturanguli in Pramana. The location of this marma in the Kati Pradesha. It is seat of an Apanavayu, and the any injury may leads to the extravasation of an urine. That is the uh, urine will withhold or any urine may going to disperse here in the at the surrounding region of an urinary bladder, which may cause the peritonitis, or if sometimes it may cause the viremia, and lastly it may lead to the death-like condition. So that is the region why the basti is to be considered as the sadhya pranahara marma here. Understood? So we can say the injurical aspect to this marma. What will occur if injury will lead to this marma? That we can say by after observing these anatomical structures, what will happen to injury will leads. The if injury will occur to the basti, so suddenly there is a rupture of a urinary bladder may be there. So what will happen? The urinary bladder sudden rupture may occur to the fully loaded urinary bladder. So it also that due to the rupture, the urine will disperse from that particular place and it will passes to the surrounding structures, that is particular to the peritoneal region. So that may infect the peritoneum and that may lead to the peritonitis, and lastly it may cause the death-like condition. So apart from that one, I was told you the one more anatomical structure coming out in this region, that is the lower part of an ureter. So suppose along with the bladder, ureters may also injured. What will cause that may infection may enter up to the kidneys, and there will be the chances of renal failures, and there will be the again the death is inevitable there. So like this certain, along with that one, during performing the different surgical procedures over the bladder or over the bladder region or that in the pelvic region, so accidentally what will occur, there is the injury to the internal sphincters of a urinary bladder may injured, that may cause the urinary incontinence. Person can't pass the urine, so painful. So that's what is the treatment have been explained. Painful will die, we have to urethra has to be dilated, which will cause the death like pains, or that may lead to the painful stimulation of an eumicturation. So here, so that's why the treatment which is to be given if injury to occurs to this particular region is very difficult. So that's why this is also called as a sadhya pranahara marma here. So this is the basti marma bhigata lakshanas: obstruction of a urine, pain in the groin area, pain in the pubic area, different symptoms of renal stones, and the other pathologies may also cause this here, which may lead to the marmabhigata. So what is the pathological condition of a marmabhigata? When any marma will injured, what will occur? As already we discussed, either it may instant death or deformity or loss of functioning of an that particular. That may be the instant loss of functioning or the sometime death may occur, but after some time the death may be the leads here. This is the marmabhigata, pathology leading to the marmabhigata. This is the concluding slide only. This is the I will end my presentation after this slide. So that's why this is the conclusion why I was given by the Dalana's quotation and Chakrapani's quotation on the Charaka Siddhisthana and the ninth Dalana's Shushruta's quotation. Why the importance to be given for this three marmas among the 107 marmas. First, I will tell you the Shushruta's quotation. Evam paramapi marmati vidhadi karanat vashad purvasya karmaha karoti ata eva teshvatyadinam shikprani kadachidashu maryanti atyagrave vakshati. So, what this quotation has been explained, these all the marmas are having the prime importance. All the 107 marmas have their own importance. But why these three marmas are important? Because these all the marmas, the functioning of all the marmas are under the control of these three marmas. Evam paramapi. So they are totally dependent on the one above the other. Purvasya karma karoti. They are dependent on the one above the other. So that's why any injury to this particular marmas may leads to the functional deformity one by one, and that may lead to the death. So that's why our Acharya has told Shiras, Hridaya, and Basti. These all the other 107 marmas are also dependent on the functioning of all the 107 marmas. Functioning of that 107 marmas means the structures which are coming under that 107 marmas, those will perform their functions, and that functioning is dependent on these three organs, the three marmas. So that's why Dalanacharya quoted like this. Where the Charakacharya has quoted as Saptottaram marma shatam yaduktam sharir sankyam adhikrityam eshu teshu marmani basti hridayam shirascha pradhana bhutan rupayo vadanti. Even the 107 marmas are there, the three marmas are important. Why? This is the second line explained. Pranashrayana tan api pidayanto vatadayo sun api pidayanti. Pranashrayam yatvam api yataha hridayadinam na yatha shankadinan. That means these three marmas is the prime location for the pranaha. So the death, any injury to this, all the marmas may also leads to death, but these three marmas will have their own importance. So this is the given importance by these three marmas by the Charakacharya. And modern anatomy peoples will also give the importance to the shiras, that is the brain, heart, and instead of urinary bladder, those people accept the lung region, which is one of the important vital organs which will control all our vital activities. So this will concludes my presentation here over the anatomical concept of three marmas explained by the Charakacharya. So after the concluding my slides, once again I will thank you for the organizer for giving me an opportunity to explain, to put forth my views on the Charakar's concept of three marmas. Thank you, the HOD of the Sharavachana department, Prahlad Gangavati sir, Associate Professor of the department, Dr. Shankarling sir, for giving me an opportunity to present my presentation. Thank you, sir.
Thank you very much, sir. There are two queries are there, sir. I am going to ask those things.
Okay, sir.
Sir, Sadhya Pranahara Marma means all the five entity, that is Mamsa, Sira, Snayu, Asti, and sudden death should occur. Okay.
Yes, sir. Okay.
Then Hridaya Marma contains only Sira and Mamsa.
Okay,
Then
sir.
why
Yes.
it is considered as a Sadhya Pranahara Marma?
Sir, why it is considered as Sadhya Pranahara Marma means what I was told in the definition of Marma itself, the Mamsa, Sira, Asti, Snayu, Sandhi, Sannipataha. The location of Hridaya Marma, we can say the Chaturanguli Pramana. Pramana of the Hridaya Marma is to be considered Chaturanguli Pramana. The Marma is located on the in the Ura Pradesha. Ura Pradesha is the place where we can find the thoracic cage if it's considered modern anatomically. Thoracic cage is the place where the bones are there or asthi is there. It is also the place for the mamsa, because heart is to be considered a muscular organ.
Yeah.
The sandhis, asti and asthis already I was told you. Sandhis also there are it is a place for the different the thoracic cage is to be formed by the intercostal joint. We can take here asti and sandhis. Mamsa is also there. then the siras and the snayus. The hridaya is the place where the complete blood vessels. That's why I was quoted siras. The meaning of a sira should not take only the veins, related to the veins. All the blood vessels are to be considered in this region, in this particular, when we will refer for the marma place. All the blood vessels should be considered as a siras. So that's why by considering all this structure, we can say the hridaya is to be considered as a conglomeration of, or it is the union of siras, snayus, asti, sandhis. So that's why it is called as a Sadhya Prana. What I was understood as the Hridaya as a Sadhya Prana, why it is included and why it is to be considered, even it is a muscular organ, why it is called as a Sadhya Prana.
Okay, sir. And another question is, what is difference between the pranayatana and marma?
So the difference between the pranayatana and marma, see the while explaining the second slide, I was told the pranayatana. The word used for the prana, the word pranayatana is to be nothing but the location of an prana. So there is no Charakacharya. He's quoted the pranayatana word for the marmas. When we detail, we will study that Dasha pranayatani adhyaya given by Charakacharya, Charaka in Sutrasthana. There he has given. While explaining the pranayatanas, 10 pranayatana is given. Among that 10 pranayatana, the 6 are considered as mahamarmas.
Yes.
There only I was told you that totally there are the 10 entities. Among those 10 entities, Murdha, Shankaha, these are to be 6 regions where to whom we has considered as a mahamarmas. But I think there is no any difference for the pranayatanas, difference in the word pranayatanas and the marmas. Just the definition of pranayatana, the location by the when we define the pranayatana, it is the place where the prana is located. But the marma is the place where all the anatomical structures along with the prana. Along with the prana. Our acharyas go marma, asti, sira, sandhi, snayu, sandhipata, teshu eva prana tishtayanti. So marmas are the places where all the 5 anatomical structures along with the prana is located. That is to be called as a marma. And pranayatana means the particular region where the prana is located. But when we'll see the pranayatana concept of Charaka, it is totally different than that of an marma concept. Why? Because Acharya Charaka given the among the 10 pranayatana, 6 are considered the mahamarmas and remaining 4. Or we can say the 6 are the anatomical entities and remaining 4 are the physiological entities. I have quoted only the 2 entities, Ojaha, Shukraha, and the Rakta. These are considered as the physiological entities. So we can't define these 4 entities are the anatomical entities, but 6 are the Shanka, Murtaha. These are the anatomical entities where he has given the name as the Mahamarmas. And all these 10 are called as the Pranayatanas. Again, we have to differentiate among these 10 are the anatomic, Kriyatmaka and Rachanatmaka, sir. What I was understood, and this is the only the difference of an opinion of an I consider the pranayatana and the marma, sir.
Okay, sir. Thank you, sir. So these
Thank
are all
you, sir.
questions, sir. So we are very much thankful to you, sir. So you have presented very effectively over the topic with the good collection of a material, sir, so that the student has recalled all the marma topic over your presentation. So I am very much thankful to you on behalf of our management, principal and staff of SVM Ayurvedic Medical College. And we ask your same support in the future also, sir. So I also extend my gratitude to all the management member, principal sir and staff member for their continuous support in the success of this webinars. Sir, thank you very much, sir.
Thank you, sir.
So shall I end the session, sir, here?
Yes, okay, sir. Thank you, sir.
Sir, thank you, sir.